Many people do not understand the impacts and the risk factors of cardiovascular disease. Today, I'll be exploring the risk factors and impacts on individuals around the world to help reduce a burden on the health systems. The pathology of CVD, cardiovascular disease, is a group of disorders related to the heart and blood vessels. This includes coronary heart disease and cerebrovascular disease. Cardiovascular disease is a symptomless disease, but is generally related to heart attacks and strokes. Strokes and heart attacks are often the first signs of CVD. When I refer to symptomless diseases, this is often like they're hidden until something happens like the strokes or heart attacks. The risk of CVD, modifiable disease, both modifiable and non-modifiable factors. Modifiable factors include high blood pressure, dietary risks, smoking, high alcohol usage, lack of physical activity, and diabetes. Out of these, though, high blood pressure and diabetes are the most impactful to an individual. Non-modifiable factors include age, gender, and family history. However, age, the older you are, the more impact it has. And then gender, if you are male compared to female, there's more higher risk as well. Personally, CVD impacted my family 7 years ago, where we lost a family member, unfortunately. Individual and local government impacts, based on towards an individual, it could impact workforce involvement and financial ability, as CVD can take us outside the workforce, allowing us not to work, and then time out of the workforce impacts our financial ability. Based on increasing life expectancy, retirement is often longer. If the average age of retirement is 65, our lifespan is slowly increasing towards the 90s and 100s. This can lead to a lower quality of life. LGAs are focused on improving early intervention and developing community engagement with Indigenous backgrounds to help develop the community and engagement. Nationally, the Northern Territory has the highest rates of CVD, with Queensland's second highest. However, Queensland is closer to the other states such as New South Wales and Victoria. This is due to Northern Territory having 50% of every 10,000 people, so 5 in 10 people, where Queensland is every 2 in 10 people. This shows a 29% difference between the states. Overall, the rates have been found to be higher in lower socioeconomic and remote locations compared to those in higher socioeconomic and urban areas. This is just more based on financial ability and accessibility to healthcare. Globally, CVD has caused under 6 million deaths between ages 30 to 70. This is largely based on the modifiable factors. The increasing population and aging population results in high demands for healthcare services. This in turn, early prevention and intervention will help reduce demand for the healthcare services and allow for other opportunities to arise. Finally, my research question. This is based off of my bachelor, so I'm currently studying IT fields. And a lot of the conversation has been around artificial intelligence. So I wanted to know how the use of emerging technologies, such as artificial intelligence, influence the early detection of CVD and develop personalized plans using predictive modeling and patient analysis. So essentially using AI to, when something goes poorly, or when there's a certain signal, it then knows what to do in the future